This week is Asbestos Disease Week, and the Asbestos Diseases Society of Australia is this week calling for funding for their research support centre so they're able to meet demand for services and data. We here are well aware of the impacts of blue asbestos in Western Australia with the historical mining which took place in Wittenoom until the mine was shut down in 1966. The impacts of that is called the greatest occupational health and safety tragedy in Australia, and it's been compared to the impact from the Chernobyl disaster in 1986. Melita Markey is the CEO of the Asbestos Diseases Society of Australia. Good morning to you, Melita. How are you today?
Good, thanks, Kelly, and enjoyed that song as well.
Ah, good. Now, we are almost 60 years since asbestos mining stopped here in Western Australia at Wittenoom, but the impacts of asbestosis and mesothelioma weren't really realised for many years. So what is the situation now?
Well, the situation is that because it was believed that when we banned the mining and we banned the manufacturing of blue asbestos in Western Australia, and then ultimately in 2003 we banned all asbestos products in Australia, that the diseases would diminish. But what the lawmakers didn't take into account was that these products deteriorate over time and then release deadly fibre into our environment. And subsequently, when we renovate, we remove these products, we then have serious consequences of asbestos-related disease, and hence we still have over 4,000 deaths per annum. That's 3 times the national road toll.
To mark Asbestos Disease Week, you're calling out for funding support for the research that you do at the centre. So what exactly are you needing, and who are you hoping will provide that funding?
Actually, we're looking to the state government to provide us with some significant funding to fully establish ourselves as an institute so we can actually properly support workers and families at risk of not only asbestos diseases but dust diseases as well. Because what we're finding now is that because the Public Health Department stopped monitoring workers in the late 80s, and pretty much similar to the time that the Limitations Act was changed to recognise the latency period of asbestos and dust diseases, it was then left back to employers to look after this. And subsequently, working with Sir Charles Gairdner Hospital Professor Bill Musk for nearly 40 years, monitoring workers and families, we found that there was a big disparity in how data was collected and how workers were managed. So we'd really like to be in a position to properly document this and create better health policy, because a challenge we have, and I spoke about this last Asbestos Awareness Week, is that we don't fall into any category of funding to support research into these diseases, to better treat people, to better support people, for earlier intervention. And so this is a really difficult situation, because if you look at the W Health Medical Research Strategy from 2023 to 2033, it doesn't include workers' health.
So how will you being established as an institute then and able to take on that research, how will that inform policy? How will you actually change the way that the health system is treating people who are, impacted by asbestos diseases and dust diseases? You mentioned that you've expanded to include that.
Well, one of the things that will be very important is actually collecting more data on the incidence of disease. Currently, we do not know how many people actually have some form of interstitial lung disease, early disease, or even silicosis, because we're not collecting that data. We only actually find out from compensation data who's had what. There's no correlation, say, for example, between the incidents that are reported to WorkSafe of dangerous work practices and actually then followed up to see if there's any diseases in the future. So a lot of this, because of the latency of these diseases, you've got to look at the long-term approach of monitoring people. So one of the things we can do is work very closely with government and say, for example, we've noticed in this particular region, there's been a lot of asbestos exposure with drilling and silicosis, and we're starting to see, saying 2 to 3 years later, a lot of incidents of COPD or other types of diseases. We need to look at how we better take action in that area. So it's about coordinating and working just as all public health programs work. It's just that this particular area falls through the gaps because they're seen as an ageing industrial disease. Oh, it'll probably go away now we're banning it. And it doesn't fall into the public health sphere because it's an industrial disease. So there's no funding from industry and there's no funding from government, yet it's a huge, huge issue.
You're calling on the government to provide funding. Have they actually given you any sort of response, or whether they're, happy to look at providing that funding?
Well, look, initially, a number of years ago, they did suggest that they were happy to work with us on funding, but that's never eventuated. So we're now actually going to be going back to government and just saying, look, it's become so much more important now with the national silicosis strategy and the regulations now that have been implemented across Australia to improve OC health and safety and monitoring for workers have been applied everywhere in Australia except for WA mining. So we need to be able to collect data. We need to be able to really support workers and support government and policy making. And I think now there's so much more knowledge, so much better opportunity to test, but we still need to be mindful that these are public health issues. These are people, they're working people. We shouldn't be relying on their employers to look after their health.
If there was one thing that you'd want people to take away and learn from the focus being on asbestos disease this week, what would it be?
That Western Australia has the most deadly form of asbestos in the world. Our buildings, our fences, our environment is absolutely riddled with it. And we really need to take very good care when we're working around this. And also we need to invest in better treatments and support for West Australians because we have the highest incidence of mesothelioma in the world. And we also have very high levels of lung cancer, asbestos-related lung cancer, which people aren't aware of. So if we can just say, park it and say it's not an ageing industrial disease, it's actually a very real public health matter. And let's put up some funding dedicated to dust diseases like they have in New South Wales, like they have in the ACT. You've got more chance of getting a grant from the New South Wales governments to support medical research in Western Australia, but you can't get one here to treat asbestos disease victims. And I think that's very poor.
Melita, it is lovely to talk to you today, and I do appreciate your time this morning.
Thanks, Kelly. Really appreciate you raising the issues.
Melita Markey there. She's the CEO of the Asbestos Diseases Society, speaking today during Asbestos Disease Week, and it is an important public health issue that we all need to be aware of.